All right, let's talk about something that, honestly, a ton of us deal with every single day, our vision. Today, we're going to dive into those common glitches in our eyes and hopefully see things a bit more clearly by the end. You know that feeling, right? You're trying to read a sign way down the road and you have to squint. Or maybe you're holding a restaurant menu as far away as your arms can reach just to make out the words. Why do things get blurry sometimes? Well, that blurriness, that's our jumping off point today. It's the clue that tells us something's up with how our eyes are supposed to be working.
So here's the official term, defects of vision. But all it really means is that your eye is having a little trouble with its main job, which is to focus light perfectly onto a tiny spot at the back. That spot is called the retina. When light doesn't land exactly there, you get a blurry image. It's that simple.
So think of it this way. Perfect vision is all about hitting a target. The light comes into your eye and its one goal is to land smack dab on the retina. When it does that, you get a beautiful, crystal clear picture. It's like a projector focusing perfectly on a screen. This is our baseline, the ideal we're aiming for. Okay, so let's get into our first problem. What happens when the light starts its journey through your eye, but it just doesn't quite make it to the finish line? This is exactly what's going on with myopia. You probably know myopia by its more common name, short-sightedness. It's that classic situation where you can read a book right in front of you, no problem, but the TV across the room, just a fuzzy mess. So what's the deal? Well, it usually boils down to one of two things. Either your eyeball is just a little bit longer than it's supposed to be, or the lens in your eye is kind of overdoing its job. It's bending the light too much. And this is the key. Because the eyeball is too long or the lens is too strong, the light gets focused into a sharp image before it even gets to the retina. By the time it hits that screen at the back of your eye, the light has already started to spread out again, and that's what causes the blur. The light's journey just ends too soon. So how do we fix it? Well, if the light is focusing too early, we need to give it a little nudge to travel farther, and that's where a concave lens comes in. A concave lens is a diverging lens. It spreads the light rays out just a tiny bit before they even enter your eye. This small change is enough to push that focal point back so it lands perfectly on the retina. Problem solved. All right, so what if you have the complete opposite issue? Instead of the light falling short, what if it goes too far and actually shoots right past the retina? This brings us to hypermetropia, or long-sightedness. And just like the name suggests, people with this can usually see things far away perfectly fine, but when they try to read something up close, it all gets blurry. The causes are basically the mirror image of myopia. Either the eyeball is a little too short, or the lens just doesn't have enough muscle, enough power, to bend the light like it needs to for close-up objects. And here's the result. The light rays pass through the lens, but they don't come into focus until they're at a point behind the retina. The image basically overshoots its target. So what actually lands on your retinal screen is an unfocused, blurry mess of whatever you're trying to look at up close. The fix for this is just as logical as the last one. If your eye's lens isn't powerful enough, we just give it a little boost. We use a convex or converging lens. This lens starts to bend the light before it even hits your eye, which shortens the light's journey and pulls that focal point forward, right onto the retina, where it's supposed to be. Now, not every vision issue is about your eyeball being too long or too short. Sometimes other things are going on, things related to aging or just the unique shape of your eye. So let's talk about two of those now, presbyopia and astigmatism. You know, presbyopia is pretty much the reason why so many people suddenly need reading glasses after they hit their 40s. And it's a totally natural part of getting older. What happens is the tiny muscles inside your eye that control your lens start to get a little weaker, and the lens itself just isn't as flexible as it used to be. It loses its ability to zoom in on stuff up close. So here's a really interesting puzzle. What do you do for someone who was already short-sighted their whole life, and now they've got presbyopia on top of it? They need help seeing far away and up close. The solution is just genius. It's the bifocal lens. It is literally two different prescriptions fused into one piece of glass. The top part has a concave lens, so you can see things in the distance, and the bottom part has a convex lens for reading. A super elegant fix for two problems at once. Okay, our last big one is a little different from the others. With astigmatism, the problem isn't about where the light focuses, it's about how it focuses. This one's all about shape. A little bit of an irregular curve on your cornea or lens can cause light to focus unevenly, which makes things blurry, but often in a specific direction, like making horizontal lines look fuzzy while vertical lines are okay. Honestly, this is the perfect way to picture it. A perfectly normal eye has a cornea that's shaped like a basketball, nice and round, focusing all the light to one single point. But with astigmatism, the cornea is shaped a little more like a football. That oval shape scatters the light, so it can't come together in one sharp, focused point. Because that light is getting scattered and focused on multiple different points, it can cause some really annoying problems like eye strain or even headaches. So to fix this very specific problem, you need a very specific solution. It's called a cylindrical lens. It's specially engineered to counteract that unique football curve and wrangle all that scattered light back into one single clear point. Whew, okay, we have covered a lot of ground. We've talked about light falling short, light going too far, and light just getting scattered all over the place. So let's pull all of this together into a handy guide.
And here it is, your ultimate vision cheat sheet. Let's do a quick recap. Myopia. You see near things clearly, the image forms before the retina, and you need a concave lens. Hypermetropia. You see distant things clearly, the image forms beyond the retina, so you use a convex lens. Presbyopia, that's the age-related one, also fixed with a convex lens or a bifocal. And finally, astigmatism, with its blurry directions and scattered focus points, needs that special cylindrical lens. It's everything we talked about right here. You know, when you step back and think about it, it's kind of amazing. We're using these simple, cleverly shaped pieces of glass to fix incredibly complex problems with our own biology. It really makes you wonder, what's next? With all the technology we have today, what will the next big breakthrough in vision look like? That's definitely some food for thought. Thanks for joining me today.